Achieving optimal care for the treatment of respiratory diseases remains a challenge. Patients often have inequality of access to physicians. Care can be patchy, dependent on geographical location, and patient outcomes are variable. So in 2015, an alliance of stakeholders from national and international institutions came together with the goal of improving care for patients. And the organisation they formed was called EUFOREA. It's gone from strength to strength, but what's its vision for 2023 and beyond? This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. The mission for EUFOREA on its inception in 2015 was simple. It was to be an international non-profit organisation working towards the common vision of preventing and reducing the burden of chronic airway diseases. That's asthma, rhinitis and rhinosinusitis. And it would do that by implementing optimal care via timely diagnosis and correct therapeutic advice. Well, it sounds simple enough, but the task was enormous. Now, over the last 7 years, EUFOREA has achieved sizeable parts of its mission to educate physicians and patients, improve research and advocacy. It held the first global CRS-WMP Awareness Day. It has published multiple scientific publications, including white papers on European patient needs and suggestions in chronic type 2 inflammation of airway and skin, and patients' unmet needs in CRS-WMP. It's also won awards, produced successful webinars with more than 15,000 physicians in 80 countries, has developed an innovation forum and forged new partnerships. Well, to tell us more, I'm absolutely delighted to be joined by Professor Peter Hellings, who's Professor and Clinic Head of Otorhinolaryngology at the University of Leuven in Belgium. He's also founder and chairman of EUFOREA. Peter, it's always brilliant to talk to you. Tell me, first of all, who inspired the international team of professors to actually establish EUFOREA in the first place?
Well, good to see you back, David. And I'm happy to share with you that EUFOREA was founded based on the suggestion of the former Commissioner of Health of Europe, Dr. Vytenis Andriukaitis, who actually encouraged a group of experts from Europe, as well as patients from Europe, to join forces and to be one body that could represent the needs of patients suffering from chronic respiratory diseases. And in that context, we have founded EUFOREA with a legal seat in Brussels, with experts from Europe, with patients from Europe, and with support of some Belgian NGOs that believed in the unique mission of EUFOREA.
Well, it's really quite an achievement, but let me ask you, why do you think EUFOREA is so unique? What makes it meaningful for physicians and indeed for patients themselves?
Well, of course, we have a conflict of interest because we are so excited about this organization, but we do believe EUFOREA is inclusive, is meaningful, is dynamic, and is also a very ambitious organization. And by inclusivity, I mean that EUFOREA combines experts dealing with upper as well as lower airway inflammation and disease, and also allergologists and pediatricians and primary care physicians. So there are actually 5 different types of doctors and physicians involved, because all of these, they see patients suffering from chronic respiratory diseases. And apart from these 5 different types of physicians, we also closely collaborate with patients suffering from chronic respiratory diseases, including allergy. So this is an inclusive organization where also not only surgeons, but also physicians dealing with the medical aspects of care join forces in order to guarantee optimal care for those suffering from chronic respiratory diseases. And we also consider EUFOREA to be a very meaningful organization because all our activities correspond to an unmet need in the respiratory field. And I refer here to the pocket guide, the simplified treatment algorithms. The latest breaking news shows the debates, and you will hear more about these debates by Professor Witke Fokkens in this show. So we do believe that whatever EUFOREA is undertaking, it's very meaningful and reaching out to a large audience of physicians and patients that want to have the best and trustworthy education. And we also believe that Euphoria is dynamic because we can jump on opportunities, we can jump on the latest publications and make these publications become implemented in daily practice, because we define criteria of care. And for instance, Euphoria was the first organization who undertook an initiative to define criteria of care for biologics in the respiratory field. And by doing so, we do believe that this dynamic organization is actually trying to achieve its ambitious goals. And quite often we get the comment of being ambitious, but as a matter of fact, with the 50 experts from Europe and also beyond Europe, like Australia, South Africa, and the United States, we try to achieve the ambitious goal of implementing optimal care in daily practice. And this may sound not achievable, but in reality it is, because all the activities that Euphoria will develop in 2023 actually try to optimize care and make sure that we shorten the disease journey, allowing the right patient to get access to the right treatment.
Well, I have to say, it's certainly been a roller coaster few years, and you've achieved so much in that time. But let me press you on that point. What are the ambitions of Euphoria in 2023 and indeed beyond that?
Well, the team of experts of Euphoria, as well as the management team of Euphoria, have real ambitions for 2023 at the level of research, education, and advocacy. At the level of research, Euphoria will join forces with many experts to optimize care by developing a novel control test, by also developing other initiatives like European Registry for Biologics, as well as by other initiatives that you will hear about more when you follow Euphoria in 2023. At the level of education, Euphoria will be the first academy really focusing on a very, very appealing and innovative e-academy, where different kind of courses will be brought to a larger audience of physicians, allowing them to get trained in the respiratory field in a very proper and very structured way. And last but not least, at the level of advocacy, we will have a new and the second global awareness day on CRS with nasal polyps, and several other initiatives in conjunction with WHO and also within the European Parliament, where Euphoria will represent the patient voice and make sure that patients get access to the right treatment whenever they're in the need of getting this treatment.
Peter, it's always a great pleasure. Thank you very much indeed to Professor Peter Hellings.
My pleasure, David.
Well, joining me now is Professor Witzke Fockins, who is the Euphoria CRS and EPOS panel chair. She's also the Innovation Forum Director at Euphoria. Very good to see you, Witzke. Let me start by asking you, what is the aim of the Innovation Forum and what exactly do you hope to achieve?
Thank you, Tony, for this question. The Innovation Forum wants to be a place of debate, of discussing together new ideas, new options of treatment or diagnosis, and to have a free exchange of ideas between all the relevant stakeholders in a certain situation, and have that recorded for future use.
I mean, you mentioned debate there. Let me just ask you, though, how do you think debate contributes to improve care for patients in the real world? Because how do you ensure it's not just a talking shop?
Thank you for that very important question, David, because that's all where it's all about, patients. And what very often doesn't happen is real debate. You know, we all write papers, we all see our patients, but having a place where people can share their free thoughts and really say, well, you know, although this is advertised as something great, in my clinic it really doesn't help, or my patient do not seem to like this, or whatever, is very seldom. And just to have all these stakeholders together to really have an open and free discussion to improve the options we have for patients, including patients in these discussions, is really very, very important.
Yeah, so really they're not just important, these conversations, they're actually vital, aren't they?
Yes, you could say they're vital, but you can organize things in a number of ways. But I think these innovation forums, what is very special about them is that it is free and open discussion, and not in an advisory board or within a clinical situation, but free, open for the public, but free for everybody to really express what they want to say. So in that sense, you can say it's vital.
So just in terms of your experience, what have you learned from the Innovation Forum in terms of empowering physicians and indeed empowering patients themselves?
Well, what is unique of this Innovation Forum is that it's a free discussion, a discussion not like in an advisory board, which is always a limited group of people, but free to express the thoughts you have about the disease and the treatment and diagnostic options, and a free exchange with all stakeholders. So not only my own patients, but also patients from other clinics, from other parts of the world, who may have a totally different view on what is best for them. And also the freedom of being able to say whatever you think is important. And I think that taught me a lot about different views on a certain subject out of my own daily clinical work, and really emphasize to look at the diamond of treating our patients from all the different facets of the diamond, and to really understand the full picture.
So just let me ask you finally, how do you see this progressing? What's next? You've achieved so much, but what's the next step?
The next step in the Innovation Forum is more debates on different subjects and involving really all stakeholders in that debate, and having the opportunity to have debates on all different parts of our profession, of treating our patients. So not only what is hot at the moment, for example, biologics, but also things that we have had for a long period of time, but really could need significant improvement over time, for example, immunotherapy or other options. So the future will bring us a broader scope of new ways to discuss optimal management of our patients.
Well, it's fantastic to talk to you as ever. Thank you very much indeed, Professor Witzke-Fockins.
It was a pleasure, Dr. Bull.
And last, but by no means least, is Mrs. Amy Quinn, who is Operations Director at EUFOREA. Very good to see you, Amy. Let me just start by asking you, I mean, clearly it can't be easy coordinating so many moving parts. So how much of a challenge is it for you?
I have to say it is quite a challenge, especially the last 2 years where everything has had to be virtual. So as you say, David, bringing the moving parts together, managing to secure the high level HCP community that we need to bring our webinars together, making sure they're available to record presentations, to be available for live discussion, which is really important. Just making sure that we can bring everything together with the team to ensure the maximum outreach to the healthcare and patient community, which is the driving factor of EUFOREA. So challenging, I have to say, but very enjoyable. And I think it's tribute to the fact that in the last 2 years, in difficult circumstances, we've managed to bring 15,000 HCPs from 80 different countries across the globe together to experience EUFOREA medical education.
Yeah, I mean, it's really quite an achievement, actually. So just let me ask you then, how do patient and political advocacy actually contribute to making sure that we actually get better respiratory care for patients?
And I think that's a really good point, actually, David. And that is the main driving factor of EUFOREA's mission, vision and value. You can educate as many healthcare professionals, as you can reach. But if you're not listening to the patient voice, then it kind of deceives the purpose. So our advocacy and patient advisory board programs, the aim is to really listen to the patient voice, to hear what their concerns are and what could help them. Because only by doing this can we kind of help the healthcare community understand what their patients need. And also I think it's important for the patient as well. You know, you're aware you have a condition, you know the symptoms, but the really important thing is to be able to explain those properly to your GP or your medical physician, because, you know, without that, people can't get the referral that they need immediately. So this is why our advocacy and patient programs are so important to us, because doing that enables us to help the patient and the healthcare professional, and particularly in connection with political advocacy, you know, to inform government and relevant authorities of what is needed to deliver the best possible healthcare.
Well, I mean, clearly, as it grows, the organisation will face new challenges. So tell me, how does the management team deal with kind of that vibrant, ambitious agenda of the organisation?
Well, I think you actually summed it up in your opening sentence to that question, David. Vibrant. Obviously, circumstances dictate at the moment that the working environment is still virtual. And in fact, obviously, you know, I'm based in the UK. We have a team based in Belgium. All of our experts are stretched across the globe. But vibrancy is the word. We're a very fast-moving, interactive, vibrant team, and we're always communicating and looking at the best ways to achieve the mission, vision and value of EUFOREA. And I think the dynamics of the team are really what helps us to move forward and deliver. It's a challenge, but I really think we're very well positioned to grow and spread our education further, and to get the patient voice across further, and to help our healthcare professionals by means of CME accredited education, and getting to them with what they need and reaching out to the patients with what they need as well.
I mean, you rightly say it's been a very tricky few years, actually. Hopefully we are starting to return to some kind of normality. So tell me, how do you view the future from here?
And again, you lead me into a point that I wanted to make. The future for EUFOREA is, well, there's two things really. The future for EUFOREA is to get back to where we were in 2019, to be able to offer physical meeting events where everybody can get together and network, because as well as the educational program, I think it's the networking and discussion that's really important. But the one thing we should never overlook in all of this, and is feedback that I've actually had, more people now, especially healthcare professionals and even patients to an extent, are having better access to education, because virtual option was something that originally was kind of overlooked, and some people have said where they didn't have, you know, say perhaps 5 days, because a day travelling to the Congress, a day travelling back, and the Congress or meeting itself, whereas the virtual option has enabled them to get access to information that they wouldn't have had previously. So we're not going to distance ourselves, and we're very much looking forward to the physical meeting environment again. But we honestly believe that this is the best position for a kind of hybrid of options, so that those that want to learn virtually because of, you know, whatever reason, they don't have the time to travel, or that the option is there for them, but we're never going to overlook the physical meeting option now that it hopefully is back in play for us all.
Very good to talk to you. Thank you very much indeed, Mrs. Amy Quinn.
No problem, thank you.
Well, that's it for this EUFOREA news show. Many thanks to my guests, to Professor Peter Hellings, to Professor Witzka-Fockins and Mrs. Amy Quinn. Now you can find more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media on YouTube, Twitter, LinkedIn, Instagram and Facebook. Until next time, goodbye.